Welcome to Kaleida Medically Speaking and our special series on the fight against the coronavirus. As you can see, we have modified our format to practice safe social distancing while providing timely and factual updates from the Kaleida Health team during this public health crisis. We as a healthcare organization believe it's important for the Western New York community to hear from our medical experts who are leading the charge in our facilities and with our workforce of over 10,000 strong. I'm Mike Hughes, and this is Medically Speaking. Dr. Dennis Kuo is the medical director of the outpatient clinics at Oishei Children's Hospital, and we're here to talk a little bit today about healthcare during this pandemic. Dr. Kuo, thanks for joining us today.
Oh, thanks for having me. Glad to be here again.
So if you can, tell us a little about the situation now with the clinics and the ambulatory business. With all the focus on the pandemic, there's a lot of fear and anxiety in the community that's taken hold. People are worried about their healthcare needs. So if you can, tell us a little bit about what the clinics are doing.
Yeah, that's a great question. So the clinics are open. And what I mean by open is that we are here for the community. We're here to serve. We have moved our clinics to telemedicine. And with a few exceptions where we do need to see our patients and families in-house in the clinics, we are open through telemedicine. And we've done that because we feel that it is the absolute safest way to provide important care for the community during this time.
So patients have an easy time connecting with you guys. How did you message that out to the patients that you guys have? Did you notify them? Were they coming to the clinics ahead of time? So how did they figure this out?
We had a lot of patients and families who were calling us. During the pandemic, a lot of things are still going on. Kids are still getting colds from time to time, asthma flares. Things do happen with our patients that need medical attention. We also have a lot of kids who will have chronic conditions that will need to be seen. Particularly, we can do a lot of those through video. And since they require the attention of a physician or a nurse practitioner, we have families that call us. We have families that have appointments. And whenever we make contact, we tell them we are offering telemedicine and we will connect with you through telemedicine.
So, Doc, if you can, tell us a little bit about the video capability. I think really the last 3 to 4 weeks have really taught, the community how to use technology like Zoom and Skype and really use that method of communication to stay in touch with people. But when it comes to healthcare, it's a little bit of a newer phenomenon for Western New York maybe, but how have you guys taken this and really pushed it out to the patients that you guys serve?
So our patients will get an appointment just like if they were getting an appointment and coming into the clinics. But in this case, they'll get a link. And when they click on that link, they will enter basically a virtual waiting room where they connect with one of us or they connect with the team. And so we conduct the entire visit over video. We have cameras that come from either our computers or a phone. And we can interact and discuss just like if we were just in a room. And a lot of what we do is really about connecting with folks, and we can do that very, very well with the video.
So I mentioned earlier when we started, the fear and anxiety that may exist for parents or even maybe kids who are patients about not being able to access their physicians or their clinics. Mm-hmm. How important is it from your perspective, from the physician standpoint, to maintain that connectivity and to make sure that you're helping patients, whether it's with something of a chronic condition or someone that may have only seen you one time at this point?
Oh, it's extremely important. And it's so important that we've made sure that during our regular hours that we are here, we have staffed our clinics so that the phone will get picked up just as quickly, if not quicker than before. That when we have our scheduled telemedicine appointments, that we are there at the appointed time and that we staff our clinics properly so that our families can get connected with us in as quick as possible. This is a really, really important time because we're getting a lot of questions about kids getting sick, about patients getting sick, what the exposure is, and how we get through this whole really challenging time. So it's really important that our patients and families are comfortable with reaching out to us as much as they can, and we need to be there for them.
Sure. So there's the telephone capability, there's the telemed capability, but you also have a limited in-person capability as well, and it's obviously because of the visitor restrictions and social distancing. Talk a little bit about who you would see in a situation like that.
So in pediatrics, we want our very young kids to be able to come in and get their shots. One of the things we want to make sure is that our kids are healthy and growing appropriately. And in some cases, the only way to do that is that we have to see them in person. We will see newborns, 2-month, 4-month, 6-month, 12-month, and 24-month-old visits. All of them are still being seen through through an in-person visit. The rest of our visits, we will do every single one of them, starting with a telemedicine visit. Well, what that does is it cuts down the traffic in our clinics to the point where we can offer the safest experience possible. That means that there is very few people physically in our clinics. That means that when they come in, the surfaces are clean, people are appropriately spaced from each other, and that families should be comfortable coming to our clinic knowing that we have given the absolute safest experience possible.
So is there any limitations in terms of appointments for any of the specialty practices?
Right now, there are no limitations. Everyone is expected to accommodate all of our families just like before the pandemic started. As I said, we are open. We are open for our families, and everybody should expect that they should get the same level of care. It's just through a different medium.
So, Doc, as we wrap up here, let me ask you this. So, this has been obviously a very challenging time for patients, for families, for providers. But is there a bright side that comes out of that in terms of the population that you guys serve, understanding the importance and the ease of use for the technology standpoint? I mean, could more telehealth be utilized moving forward?
So I'm very hopeful that this will actually become part of our norm. There are things that we have to do in person, but there's a lot that we can do through a video conference. And our families have been incredibly receptive and positive from the whole experience. You know, the benefits are that we can deliver care right to families' houses, apartments, and living rooms. We can do it quickly. We can do it effectively. And I think that this may become part of our norm going forward.
That's great to hear. Dr. Dennis Kuo is the medical director of the outpatient clinics at Oishei Children's Hospital. Doc, thanks for joining us today.
Oh, thank you. Thanks for having me.